Hi everyone, welcome to Szenan-Balance. Welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today our topic is what causes arthritis. What causes arthritis, right? So we share live video every morning, New Zealand time. Today is about 7 something, nearly 8 o'clock now. Today is Monday. Yeah, our clinic closed on Monday. We operate from Tuesday to Saturday. Now it's a good time to talk about arthritis. A lot of people suffer from arthritis, right? So a lot of people suffer from arthritis. We talked about what is arthritis yesterday, right? So more people get it. It's a disease that gradually form, right? Then elderly people, that happen in elderly people more, like over 65, over 65. Okay, but it can also that happen in kids, young adults, teenager. Yeah, it can. Well, and women get more chance to get arthritis than men. Then people overweight, then they are more commonly to suffer from arthritis. And two common arthritis we talked about yesterday, they are OA and RA. What's OA? Osteoarthritis. What's RA? Rheumatoid arthritis, right? Now, today we're going to talk about what are the causes of arthritis, and think about OA and RA. Yeah, so they are two most commonly arthritis. In fact, there are hundreds types of arthritis. So you know that, and some patients, they can't fit in RA and OA. Wow, that is according to the Association of Arthritis in America, and there is a new diagnosis. It's not new anymore, but anything that pain in the joint, and you get stiffness in the morning, painful, and if it's longer than 2 years, and the blood test is fine, the X-ray is fine, then yes, they will give you a hate for you wait on arthritis. That's how it goes. Right? This is how they diagnose arthritis. Okay, now let's talk about what causes arthritis. Okay, now you know the structure. I don't have it here to show you. On the joint, all joint over here, we have a tissue called cartilage. So cartilage, what is cartilage? The cartilage is a form but flexible connective tissues in your joint. So which every joint you have this thing, right? What does it do? Cartilage is protecting your joint by absorbing the pressure and shock created when you move and put pressure on them. Okay, when you're standing up, where do you put pressure on? You put pressure on hip joint, knee joint, ankle joint. You see? You put pressure on those joints. When you move, when you carry thing, something like this, what do? You're moving your joint as well as put pressure on your joint. So without that tissue, cartilage, your bone gonna touch your bone. Your bone's gonna touch your bone. So it's gonna weigh off your bone. If your bone keep doing this, it's gonna weigh off. So what happened in the cartilage is try to make some space in between them. You know, it's a cushion, just like a cushion. That so if you put cushion in between those, you know, if I put cushion in between those, so I won't bump to myself. You know, this is try to get them flexible, right? So it's a reduction in the normal amount of this. If the cartilage reduce, this tissue reduce, and it may cause some forms of arthritis. Okay, hi Kika. Nice to see you again. Thank you. Oh, I did it. How did I do that? That happened again. I think I did it previously. Turn the camera to the other side. That's funny. Okay, when you are here meeting me in my live video, please give me a thumbs up and say hello to me. So we're getting colder in here. I don't know about your country. I think most of the other country getting warmer, right? And spring into summer, and we're getting into winter. Okay, we're actually in winter now. Okay, now so I have problem with internet these days. I'm out of the city. Oh, okay, out of the city. Yeah, okay, I understand. No problem. You're online now. No problem. You don't have to apologize to not didn't watch me. I actually create a short video right now, so it's a few minutes. It can be 1 minute or one or 2 minutes video that's on we call IGTV. I just figured out I can do this, and I do some research about it. So if you missed this live video, because live video we're gonna talk more about a bit deeper, you know, and the IGTV is shorter, you know, get into the point, just tell you what's going on with this disease or something like that, what's causing it, just a short one, and I read it out to everyone. So it's some of information, then you can check on. It's about 1 minute, 2 minutes. I post it on my IG and Instagram, and I post it on YouTube as well. So you can go in YouTube and IG as well. And if you miss out, you want to catch up, then all live video available on YouTube as well as the IGTV available on YouTube as well. Okay, so subscribe to my YouTube channel, and my YouTube will notify you whenever I have a video upload. Okay, so that is a great step to talk to you, to inform you about. I'm trying to turn on the other computer. It's very old and slow one. Okay, let's talk about the most. So the most commonly arthritis is OA and RA, right? Osteoarthritis and rheumatoid arthritis. Now, so what causing those? What's caused OA? Okay, OA is a normal wear and tear. A normal wear and tear causes OA, which means that's why we talk about more people suffer from, and more commonly, people suffer from arthritis that is over 65 years old, and they are more commonly suffer from OA, which is osteoarthritis. Okay, so this is one of the most common form of arthritis, right? So an infection or injury to the joint can exacerbate this natural breakdown of cartilage tissues, right? Which means if you have an injury, you know, now we know what is wear and tear, which it take a long time, and you may have an injury. Football player, rugby in New Zealand, you know, a rugby guy, they catch up, bumped each other, and they got injury, but they didn't treat it properly. You know, you heal. Eventually, you don't get pain, but it doesn't. I want to tell you something. Now, if you have an injury, you better get someone to look after you, because you may have no pain, especially on your shoulder, you know, but the range of movement, it may be still there. The range limitation of the range of movement, which means you're not getting fully recover. Okay, getting fully recover is important, because when you get fully recover, you actually prevent wear and tear form of arthritis or OA in the future. So that's important, because I see my patient the other day. He had a new patient. He came in but while the lockdown time, you see, he loved sport, a lot of different sport, and he fell off a bike and hurt his shoulder, and the collarbone actually fractured. And while the lockdown time, no treatment, because lockdown time you can't go anyway. You know, you can't go anyway. You got 12 weeks to race, and another 6 weeks, and then no treatment that 6 weeks. And when he first started, hurt himself in the 12th week, and he got some treatment, but in the 6th week, no treatment for him. No treatment for him. Like when he came in for back pain, and he told me, "Hi, Judith from Holland. Thank you. Alali, nice to meet you. And is it Morgan Mohammed Dizada? Thank you for watching this video, and bless me. Bless me. I'm sorry about that." So what happened is, that patient called in with back pain, which is a spine problem. Okay, back pain over here, but his shoulder was painful, but no longer painful. He said, "Oh, it's healed now. It's fine. It's fine now." I said, "Well, hi, Carol. How are you?" I said, "How? Lift your both hand up," and he lifted like this. "Well, no problem." And sideways, no problem. But in the back over here, he can reach this hand like this, and the other hand he only be able to reach that part. You see? So that hand he can go up there, that hand go up there. And he told me it was healed. No problem, no pain. Well, pain is just one of the symptoms. So most people think about pain, because pain can stop you doing things, prevent you doing something, you know. But same as range of movement. But for your shoulder, mostly we just reach out like this, reach things like this, but we don't do this, right? This movement, we don't do it much. So that is important too. Okay, if this shoulder doesn't treat it properly, it will stuck in just that range of movement for a long time. So this is an injury that, if it hasn't recovered properly, then in the future, when we age, it's easy to form to osteoarthritis. Okay, so this is the idea. If you injured yourself, yes, you get it done. So physio, therapy, osteopath, chiropractor, acupuncturist, then whoever can help you, to get them to help you to recover properly. So when you recover properly, we have the highest chance to avoid osteoarthritis when we're getting older. Right? Everyone's aging. No one's getting younger. Right? Unfortunately, no one's getting younger. Okay. So that is the So our OA is how it causes it. Okay. So now you may heard a lot that arthritis is if you have a family history, you know, you're much easier to develop arthritis. Okay, so your risk of developing OA may be higher if you have a family history of this disease. Yes, that's right. So think about it. Okay, family history, which means about genetic again. So what we're talking about? When we're talking about genetic, we're talking about the diet habits. Your diet. Your mom, your parent, they eat that way, and then you follow. And when they get sick with this disease, and you get sick with this disease. So how do you break it? When they eat that way, you don't eat that way. You eat the other way. Do the opposite. Do the opposite. Okay, so that's important. So when everything that it comes with family history or it's genetic markers, genetic method that causing this, you have high chance to develop blah blah blah, suffer blah blah blah. You know it. That is because of the diet, lifestyle, or emotional. Okay, we talk about that. This is how I think about it. All right. Okay. Another common form of arthritis is RA. What is RA? Rheumatoid arthritis. So we call RA simple, right? Rheumatoid arthritis. So rheumatoid arthritis is a different arthritis. It's an autoimmune system problem. It's an autoimmune disorder. Let's put it that way. Autoimmune disorder. Okay. It occurs when your body immune system attacks what? Attacks the tissue of your body. So your own body immune system attack your own body. Attack the tissues. So what tissues? Okay, this attacks affect the synovium. There's a synovium tissues being attacked by your own body, right? By your own body. So RA is not to do with injury, it's quite different. So OA is wear and tear and is infection and injury that causing it, right? But RA is your own immune system attacking yourself, attacking the tissue. We call it synovium, right? This is important. So what is synovium then? The synovium is a soft tissue in your joint that produces a fluid. So what is this fluid doing? Okay, the function of this fluid that produced by synovium, and it can nourishing your cartilage and lubricate the joints. So it actually nourishing the cartilage. We know that the cartilage is between the joint, something that it can absorbing and the pressure from joint to joint, right? Then, but what make it so powerful? Then it can absorb those pressure. Okay, what make it so powerful that cartilage can absorb it? When it's dry, no, it's like a cushion. It needs fluid, It's like a balloon, it needs water. It's a water balloon. So the water balloons has the function to absorbing the pressure, to decrease the pressure, right? So this is important, right? So if the fluid reduce, which in the cartilage, get less fluid on that, and that become a problem. So it's not as strong. So the ability, the strength of the cartilage is actually come from the fluid that produced by synovium, a tissue called synovium. Okay, simple, right? easy. But if the synovium has been attacked by your own immune system, then unfortunately it will form what we call RA. Right? And so RA is a disease of the synovium that while invent and destroy a joint. That's awful, isn't it? It's awful, okay? It can eventually lead to the destruction of both bone and cartilage inside the joints, right? Now, the exact causes of the immune, now we know it's actually caused by your own immune system, but the funny thing in here is that exactly what causing, we know the RA is caused by the immune system attacking your own tissues, but what causing the immune system disorder, what we call autoimmune disorder, you know? So what causing this autoimmune disorder? I'm sorry, we don't know. Until right now, we don't know. That is why that there is no treatment that can fix or cure RA. Very unfortunate, you know. So the scientists have discovered genetic markers that increase the risk of developing RA 5 times. Again, it comes with a genetic issue. Again, when we said about genetic issue, what's causing in there? When it's unknown problem, then it's always come with genetic. Be in mind, always come with genetic. So when it's unknown, it comes to genetic. And what does it mean? It means that it's in your diet, it's in the emotional. It's in the diet, it's in emotional. That's how you learn from your family. Diet habit, emotional. Okay, let's talk about why diet and emotional. If we use the idea of Chinese medicine to understand this, it'll be so easy. Okay, it'll be so easy. Why diet? Why emotional? Okay, now the Chinese medicine talk about, well, there's something new for you if you are not an acupuncturist. Wind, cold, dampness, that causing arthritis, causing pain, you know. So where is the pain come from? It doesn't matter whether it's OA or RA. OA or RA, okay? OA and RA are both in Chinese medicines, in acupuncture theory, they are wind, cold, dampness. It can be heat, but mostly wind, cold, and dampness that in the joint that causing this problem. Why? When you think about this, oh, okay, it doesn't make sense. What wind? What it's called? What is dampness? Okay, let me explain to you. In Chinese medicine, this is how we think. There is a term we call, if the flow, the bloodstream flowing good, there's no pain. When the bloodstream block, slow, it becomes slow, it block, that cause pain. Why is that? Okay, let's think about it. In the arthritis, it's the cartilage that wear and tear become OA. In the RA is because of the you haven't got enough, you get attacking yourself, the synovium, attacking the synovium tissue that not allow it to, or decrease the fluid, right? Then the fluid, no fluid to narrows the cartilage. Then that cause arthritis. Okay, then what is blood? So important. Why bloodstream is so important? Because blood bring the nutrition, bring the temperature, bring the oxygen to the joint to heal. So when you have an injury, then you need the blood flow go there to heal it properly. So if the blood flow slow down, you haven't got enough nutrition to the joint, you haven't got enough nutrition to the joint, then it won't heal properly. When it doesn't heal properly, there's always something wrong in there, which means over the years, the blood flow go there, bloodstream go there, it's less than the other side. That's why it causes, for the long term, it causes arthritis. The cartilage wear off because it can't maintain itself. Not enough blood flow to help it recover. Same thing. And your autoimmune system attacking the synovium. So how do you get healthy synovium? You need your blood flow get there to narrow it. Simple, right? That is why we talk about in Chinese medicine, without blood flow, nothing would happen. Now, I put it in a way I call blood flow is the king. How do you keep healthy? Blood flow. Blood flow in your body is the king. If there is no blood flow, you die. So blood flow is the king. Remember this. When it comes to Chinese medicine and disease, blood flow is the king. It's all depends on blood flow, right? So now, what is in the blood flow that help you heal? Where do you get the nutrient from? From what you eat, what you breathe in, the oxygen. So the oxygen and what you're taking by daytime in your meal is important. If you keep eating junk food, you find a lot of animal fats, animal protein, then your blood flow, the quality of your blood is not good, then it will cause arthritis because you haven't got good blood flow, because your quality of your blood is not good, then it can't narrow the cartilage properly, then it forms arthritis. This is the theory of Chinese medicine. And the wind, the cold, and the dampness then prevent the blood flow go to the joints. So a lot of arthritis patients, when it's winter, they get more pain. That's what we call the cold. Why wind? When the wind blows, it creates coldness. When the wind blows, look, when you're so hot, what do? Oh, I'm so hot. Why is that? Because it cools you down when you fan it. It creates the air, create the wind. So this is how it happened. When this wind, if you are not protecting yourself, keeping warm on your joint, the wind keep blowing, on the joint, that created coldness, and the coldness attack your joint, and they prevent when it's cold, what do? Oh, it's cold. Contraction, the muscle contraction. When the muscle contraction, look, this is the muscle contraction, just like you holding the arm, it contract. My muscle contract right now. If this had got blood flow going, right? Oh, when I'm feeling cold, oh, it's so cold. You grab it. Compare with that side, that's not cold. You grab that side. What's the blood flow on that side? The blood flow on that side can be decreased. When it decreases, not enough blood flow into the joint, then the cartilage wear off. Or when the autoimmune system that attack your synovium, But you need blood flow to go there and to help you recover, right? Everything can recover. You have the self-heal. Your body can heal yourself, but not without blood flow, not without quality of blood, right? So acupuncture is the best thing for blood flow. That's why when you put acupuncture needle in, the pain suddenly gone. Why is that? Because it creates more blood flow into that area. So that is important to keep in mind. That's how acupuncture works. That's how Chinese medicine works. That's why Chinese medicine and acupuncture are very good for arthritis treatment. All right, that makes sense to you. So dampness, okay. We talk about wind, we talk about cold. How about dampness? Yes, dampness is water. It's a fluid type of thing. When the dampness, what is dampness? Dampness is the water in your body. It should move. It should pass out the body, but instead it stay in your body and accumulate in one area. What in your joint? That's why you get swelling, right? When it's accumulating over there, and it stops the blood flow flowing there. Again, it causes wear and tear, arthritis. It causes the immune system problem because not enough blood flow in there to heal the joint, to heal the cartilage. Does it make sense to you? Yeah, good explanation. Yes, thank you, Judith. This is how I understand it, and how the Chinese medicine talk about this. So when the Western medicines, okay, nothing wrong with that. I love it. It explains the term. It see what's happening in the joint, but in the end, it tell you we don't know what's causing it. They see the process. Let's say from this way to this way, over here, from here to here, right? The Western medicine see it. Whoa, this car from here to here. But what's the health of the force? What causing it? And what actually pushing this to here? I don't know. I don't know why this is going to here. But I know the process from here to here. I think that makes sense. Yeah. Right? This description, the letting me know from here to here, it makes sense. And everyone can see it. You go x-ray, you see the change. 10 years ago, you get an x-ray, you hurt yourself, you get x-ray. Oh, your x-ray of your knee is fine. It's good. Now, 10 years after, you still have pain, or if no longer pain when you started with injured yourself, you get an x-ray, no problem. And it slowly developed. The x-ray doesn't tell the blood flow. Unfortunately, none of the tests, x-ray, MRI, ultrasound, can tell the blood flow. No one can tell how your blood flow is good or not. No one can tell. None of the machine will tell you your blood flow is great to your knee or to your joint. But in Chinese medicine, we are smart. If you have stiffness in there, your blood flow is not good. If you have pain in there, your blood flow is not good. If you have limitation of range of movement, your blood flow is not good. That's it. Simple. All right. If you feel cold, your blood flow is not good. So keep warm. This is what we do. We always tell patient, inform patient, keep warm. It's important. Okay. Now we talk about from here to here. It's good. X-ray, we can see it. 10-year time, you have no pain. You injured. You heal pretty good. X-ray, no problem. And gradually, after 10 years, you start to feel stiffness. You just get pain. So from here to here, after 5-year time, they take another X-ray and say, oh, unfortunately, you develop wear and tear, osteoarthritis. I think it's caused from the injury. You don't look after. You don't look after properly, so it developed arthritis right now, but it's not bad. Yeah, you say, oh, it's not bad. It's just a bit of stiffness in the morning, and the pain is bearable. So let's take some painkiller, because there is no treatment for it. The best treatment is painkiller. It's not so bad. And after another 5 years, so injury 5 years, you develop arthritis. You take actually a bit of arthritis in there, wear and tear, and 10 years, oh, the pain become unbearable. Yes, you take another X-ray. Oh, I'm sorry, you need a knee replacement. You need a knee replacement. So it's good that we have X-ray along from 5 years, take another X-ray, 10 years, take another X-ray. We can see that the difference in your cartilage, it way off. Now it's bone and bone. But what is the real reason? Oh, the reason is because you injured yourself. Then it happened. Now, have you ever asked the question? But you said 10 years ago when I hurt myself, I came to you, you did an X-ray, you said everything's fine and I have no pain. You said heal very good, no problem. So why now arthritis, osteoarthritis, you tell me it's caused by the injury? It doesn't make sense. Yeah, it doesn't make sense, right? So what is real reason causing it? The blood flow. Because you didn't protect yourself, because your doctor didn't tell you that even just a little bit of stiffness, it hasn't been healing properly. Because your doctor didn't check you when it heal, we need you to fully be able to fully bend. The both legs need to be same range of movement. Some people just live with one leg can bend, the other can let back fully, and because it doesn't stop you doing things, it doesn't prevent you doing things, it probably just slow you down a little bit, but you don't care about it. And your doctor said it's fine because the X-ray is fine. But you know you're not fine. That's what causing arthritis, develop into arthritis. Is it what you want? If that's what you want, that's okay. 10 years, 20 years, or after 65, when you're over 65, you develop arthritis or osteoarthritis. So don't blame your doctor. Don't blame other people. If you watch this video, you know now what's causing arthritis. You know? So if the blood flow is good, and we need to know how to bring the blood flow to the joint, that's first thing. Second thing, we need to make sure the quality of the blood is good. What's the quality of the blood? It's good. The blood is built from what you eat, based on what you eat. So basically, any kind of disease that are related to your diet, you know, any kind of disease related to diet. Why is that? Because your blood is based on the nutritional that you eat from your food. If you eat junk food, if you're not eating healthy, then your blood won't be healthy. It can't heal. I'll give you another idea. It's causing pain, right? And the Western medicines, we all know about this. I got a heater in here. It's become too hot right now. So I've turned it off. In Western medicine, we know this is the way that we can easily understand why diet is so important. Okay, in Western medicines, we know that the chest pain, you know, heart attack, the stroke, chest pain and heart attack, the stroke is because of the cholesterol. The cholesterol form on the arteries, then stop the blood flowing. Then you start to feel pain, you get headache, you get dizziness, and when it's fully stopped, the blood flow going through the artery, it gradually happens. It's not 1 or 2 days. It gradually happens. And what happened? Then you get stroke, you get heart attack. So this is what happened. We call plaque. It forms plaque in the arteries. This is the artery. A lot of blood flow go through. The blood flow go through. Oh, a lot of blood. I put water in, it'll go through, right? What is the best way to understand this? You get a pipe, you put water in, about that big pipe, you put water in, it goes through smoothly. But what about that? What is the difference? That is that big, and that's the other. Which one will flow easily? Of course, this one, because that one's more narrow, right? So what happened right now? This is the normal artery, let's say. Then the plaque build up. The plaque is built from cholesterol. So look, the plaque coming up. Oh, the whole, you can see my eyes, right? But gradually my eyes disappear. Why is that? Because it's all blocked. So when the plaque building up slowly, it decreases the blood flow. It decreases the blood flow. That is why we call it, when the blood flow, the bloodstream flow slow down or blockage, block completely, it causes pain. It causes pain. So we need to remove the plaque by doing what? Changing your diet, changing your lifestyle, because the plaque over here decrease the blood flow. Okay, we need to, cholesterol is formed. Cholesterol is a good thing. We talked about that the other day. It's just too much. The LDL is too much, so it blocks your things, and your blood is too thin, too thick. You need to thin the blood. But thinning your blood, it doesn't actually, you take medication, thin the blood, it doesn't actually stop forming the plaque. How many people they are on medication that thin the blood, they still get heart problem, they still get blocked up with heart problem, and they still get stroke. You know, it can cause bleeding type of stroke, or it still get blocked up of the chest, and they eventually need a bypass, which means it doesn't help. The medication didn't actually stop your body form the plaque. It didn't actually decrease the cholesterol. People cholesterol check every day. Oh, it's healthy. Your cholesterol is normal. They still get heart disease. Why is that? Because it check the cholesterol. It actually check the blood, the cholesterol in your blood. It doesn't check. It doesn't actually tell you how many cholesterol has been formed to the plaque. Does it make sense to you? You know, so the blood test of the cholesterol, it can tell the cholesterol, the quantity of the cholesterol in your blood, the amount of the cholesterol in the blood, but it can't tell how many amount of your cholesterol has been converted to the plaque. Any amount of the, if your body convert the cholesterol very fast to the plaque, so all your artery have plaque in it. So your artery become smaller. Then when they take the blood test and they tell you, now you're pretty healthy, your cholesterol is fine, and then after 1 or 2 years, and you get heart disease. And I'm sorry, you get heart disease, but your cholesterol is still quite good. I don't know where you get it, but we know that the plaque is from the cholesterol. Why is that? They're just smashing themselves, because we respect the test, to be honest. If the test say it's fine, it's fine. But if the test say cholesterol test say that your cholesterol is low, it doesn't mean that you won't form the heart problem. The stream was still good. your bloodstream was still good. Okay, so using this theory, so Western medicine know about this, then we know that changing diet is important, because when the plaque develop, the bloodstream will be low, then you form arthritis. Okay, same thing. Anything to do with everything to do with the blood flow. Blood flow is the key. So your diet is important. Anything that can cause your cholesterol, bring your cholesterol high, then that's not good for you. Anything that can reduce your cholesterol, here you go, is good for you. Right. I hope this all makes sense to you. So tomorrow, the live video that we're gonna do, the topic is how is arthritis diagnosed. All right, we're gonna talk about how to diagnose arthritis. Okay, so that is tomorrow's topic. Yeah, today's topic, we finished this. I hope you all understand it. So we talk about the Western medicine, how they talk about what they reckon about what causing arthritis, the causes of arthritis. Now tomorrow, and I explain about Chinese medicines, how we think about what do we call about arthritis, how it developed according to Chinese medicines, right? What's the reason? Then tomorrow we're going to talk about, well, how do we diagnose it? Yeah, how is the arthritis diagnosed? Why is that? Because it can be pain or painful. There's 100 types of arthritis, and how do you diagnose it? This first thing. How do we say that this pain is arthritis? It's not causing by other problem. How do we actually give you a hit on your head and say this is OA, this is RA? That's tomorrow's job. Okay, so stay awesome, and I love you all. Hang on, there is something that in here. Bruce T. I bet T say TCM blood toxin. Treating that is not treating the cause. Diet and antifungal herbs to help the small intestine are the answers. I agree about cholesterol and blood thinners. Thank you. TCM blood toxin. Treating that is not treating the cause. Diet and antifungal herbs. Good. Treating arthritis without treating the small intestine is pointless. Okay. That's your opinion. Thank you. Now, very good comment in here. I love it. Okay. I haven't got the things in here. Now, interesting, you talk about intestine. Okay, that's on the structure view. Okay, and the function of that, and that's pretty good. Okay, and I love it, to be honest. Okay, let me talk about what intestine. It's good that I love this engagement and comment. Okay, and then we can talk deeper. Okay, intestine. We pair up with intestine with heart, right? And 5 elements. Intestine is working as a twin sister or twin brother with heart, right? And please don't use the Western medicine thinking or theory to think about the organs. We are talking about Chinese medicine right now, okay? The Chinese medicine theory, heart and small intestine work together. Okay, work together. Then we talk about blood flow. The blood flow, who control your blood flow? Heart. Heart pump the blood flow go to your entire body. Okay, so yes, eating is important because we want to make sure that the quality of the blood, you have the good nutrients to heal everything, right? This is the first thing. But think about it. If you're eating healthy, but your heart is not working as hard as one, and the heart is not pumping properly. You haven't got the string in your heart to pump all the blood out to your entire body. What would happen? It won't heal. It won't help, and it won't heal your arthritis. Okay, it won't heal arthritis. Okay, then what is intestine doing? It absorb all the nutrients, it absorb that into the blood. Okay, so this is important too. Yes. So we treat, when we come to arthritis, we are not just treating, putting acupuncture and bring the blood flow. It's not just that simple. If you want to get the blood flow, you can simply rub on it, rub here. When you rub it, the blood flow will be good. So massage is good. But have you heard about using massage to cure or to fix your arthritis? No. But massage can bring the blood flow there, right? Yes, that's right. But massage the joint over here, it can't help the organ function. It doesn't actually improve the organ function. In Chinese medicine and acupuncture, when we bring blood flow to the joint, we also treat the root. What's the root? The root is the organs. We want to bring the organ function better. We bring the heart better. We bring the intestine better. Thank you. Small intestine is important, but we also treating small intestine as well as treating other organs. We treat all the organs. Do we just treat all the organs for everyone? No. We need a diagnose to find out what organs are out of balance, what organs are not functioning properly. Then we treat the organs. We bring the organs healthy. In Chinese medicine, again, there's a Chinese medicine theory not to do with Western medicines, okay? The cartilage, arthritis developed because of the cartilage. Where it's here, the cartilage string controlled by liver and gallbladder. Right? This is out of the theory of Western medicines. So we need to check. In arthritis, when they come to arthritis, we treat the liver and gallbladder. They always have problem, and we need to bring the liver and gallbladder function back to normal. Then when we bring it to normal, then the cartilage will be healthy. The will heal, and it will have its strength. Okay. And apart from liver and gallbladder, we treat stomach and spleen. Why treating stomach and spleen? Partly because you take a lot of medication, the painkiller that ruin your stomach and spleen. Because if your stomach and spleen are not good, you can't process your food properly, you can't absorb it properly. Same as small intestine. Then in Chinese medicine, stomach and spleen control muscle strength. And how many people that suffer from arthritis, they lost their muscle because they haven't been moving properly. They haven't been because of pain, and they stop moving or decrease the activities, and the muscles losing. Why muscle losing? That's because the stomach and spleen is not functioning properly. Simple. Then we treat the kidney and bladder as well. Why treating kidney and bladder? Because kidney control the bond, bladder control the bonds. We'll say quality of blood controlled by kidney bonds, spleen and small intestine absorption, heart and blood vessel circulation. Fantastic. Your screen is dark. Oh, my screen is dark. How come it's dark? I don't know why it's dark. I'm sorry about that. Thank you for letting me know. Is it always dark or just dark right now? Let me clean it. Okay, I hope that helped. I don't know whether it helps or not. Well, this is something that we talk about in Chinese medicine. Yeah. So, but we talk about kidney, we talk about heart, we talk about liver and gallbladder, all those things, And I'll tell you, the way to just treat everyone the same. No, the diet is the same. Everyone need to eat a clean diet, change their eating habit. But when it comes to Chinese medicine, we really want to find out which organ is out of balance, not working the most. We may still treat all the organs, but we need to focus. Do we need to focus on this organ or that organ or that organ? That is why you need an acupuncturist in Chinese medicine or a health practitioner to work it out. What do we need to focus on first? And we bring this one up, then we go and bring the other organs up, something like that. So when that's become in treatment, all right? So I hope this helped. Thank you, Bruce, to bring up this topic so we can talk a bit deeper. And this is Chinese medicine, and I don't talk about that deep because the time limit, and no one has been asking about this and talk about this. So if you have any question, comment down there, and I would be happy to let you know what's going on, okay, according to Chinese medicine and how we treat it and everything like this. Okay, all right. Stay awesome, and I love you all, and thank you for being here and joining this live video and supporting me. And stay awesome, and we'll talk about how's arthritis diagnosed tomorrow. Stay awesome, and I love you all. Bye bye.